Hello, hello, hello. This is Dr. Jenkins, and this one video will be our coverage of the integumentary system. For those of you following along, this is our first body system. So our beginning 4 chapters were introductory, foundational, and from here on out, we're just going to go body system by body system. So our first body system to cover is the integumentary. All right, the integumentary system, let me skip ahead just one slide, couple slides. Yes, the integumentary system consists of the skin and also some accessory structures, hair, nails, sweat glands, oil glands, things like that. So it's not just the skin, but it's some accessory structures embedded within the skin. So we'll start there. The integumentary system is made up of the integument, the skin, and some accessory structures embedded in the skin, such as hair, nails, oil, sweat glands. The skin is the largest organ in the body. You don't need to know that, but it is. And by the way, what is an organ? A collection of tissues with similar structure and function. The skin is indeed a collection of skin cells and skin tissue, so it's an organ. All right, by and large, the skin is there for protection, but there's some other goodies that we absolutely need its help with. We're able to absorb some things through the skin, we're able to excrete some things through the skin, and the skin helps us with a very important job of body temperature regulation. The skin, it's really cool. It's waterproof. It's not water resistant because sometimes we do want to get a little bit of water in there, keep it a little bit moist. It can be repaired, and we're able to absorb and secrete things that we need. So it's quite specialized, serves us very well. Let's be more specific with the functions. Make sure you familiarize yourself with all the functions of the integumentary system. Obviously, the skin is a form of protection. Make sure you know, not only is it a mechanical protector and a physical protector, but it's also a chemical barrier. For example, the oil of our skin contains some antibacterial properties. So certain microorganisms that get on our skin, the antimicrobial properties of the oil of our skin can kill them right then and there. We're able to do some absorption. We can absorb UV rays that allows our body to synthesize or make vitamin D. This is one thing I think that can be a misnomer. We don't absorb the vitamin D as vitamin D. We absorb the UV rays from the sun. That's what gets absorbed through the skin. And the UV rays are one ingredient that our body needs in order to make vitamin D. We can't forget the skin has all sorts of specialized nerve endings that act as touch receptors. And this is really important, not only for everyday or pleasurable things, but really the main function of these is protection, so that we know what it feels like when something we touch is hot or sharp. It's all due to these specialized nerve endings that allow us to have senses of touch, but also helps us to be protected against things. And then there's another biggie, body temperature regulation, in the form of what we probably think of most is sweating. So if our core temperature starts to go up, and it's going up too much, we of course need to release that heat built up in our body. And one way that we can do that is through sweating. We can purposely send some fluid to the surface of the skin. Some of that fluid reaches through the skin to the surface of our skin where it evaporates. And that evaporation has a cooling effect on the body. But this is really important, folks. Without our ability to sweat, we probably would not be able to maintain our body temperature when it gets really hot. Okay, let's talk about the structure. As I already said, the integumentary system is made up of the skin and then some accessory structures. We're going to start by talking about the skin. We're going to talk about it in two main layers, the outer layer of the skin, known as the epidermis, and then the underneath layer of that, or deeper layer, is called the dermis. We do have a layer at the very bottom that we call the hypodermis, which we will discuss briefly, but our focus will be on these first two. Here is our patch o' skin for reference. I mean, you had no idea all the cool things going on in the skin now, did you? Big old party. So I'll be referring to this as we go through our discussion. And I'll also be able, because we just came out of the histology and tissues chapter, I'll also be able to show you some real microscope slides of the skin, and we'll be able to understand which layer is which. But I'm going to come back to that. Let's just first start with the epidermis. It is the outermost layer, so it's just from here to here. It's just this gold-colored region, epidermis. We already know the primary tissue type in the epidermis is stratified squamous epithelial tissue. And of course, it's many, many layers of flat-shaped cells because we want to have protection. Now, the thickness of the epidermis, so now remember, we're just talking about from there to there. The thickness varies depending on where we're talking. If we're talking about the sole of your foot, well, wouldn't it make sense to have a thicker epidermal layer? Of course. Now, we can actually be very specific because within that epidermis, so remember, we're still only focusing on this layer right here. Within that, we define different regions. Most parts of our body have 4 regions of the epidermis. When we need it to be a lot thicker, we add on an additional region. And I already give you one example of where we might need that thicker portion of the epidermis, and that would be in the soles of our feet, but also the palms of our hands. Areas where we have a lot of pressure that go through a lot of wear and tear. You might see that in some textbooks they call these layers, and I find that to be a little difficult because it's not just 4 or 5 layers. I mean, if I just look at what we saw already from histology, right? This is the stratified squamous epithelium. It's more than 4 or 5 layers. I mean, here's one layer, another. I believe there's somewhere usually between 12 or 15 layers. So that's why I'm choosing not to use the word layers. Instead, I like to use the word regions. So let's look. Here is a schematic. This is the epidermis. So we're only looking at the epidermis. Well, let me be a little bit more specific here. I got a little carried away. And like right here. So between these brackets is the epidermis. We're only focusing here. We're just focusing on it up close. We could identify, based on what's happening with the skin cells, different regions. The outer region, the most superficial region, is called the horny region. I know, funny. The fancy name for this is stratum corneum. We're going to use the everyday terms, the horny region. So the horny region, and again, I prefer to use the word region instead of layer. It's the outermost layer. Underneath that, this is the extra layer. This is only extra region. See, I confused myself. Let me just cross them off now. If there was a 5th region, it would be added right here. So that extra in the region in the palms of our hands and soles of our feet is called the clear region. But every region has the horny, outermost. Then we talk about the granular region between here and here. It's given the name granular because you see those little dots or granules. Then we have the prickly region. That's a pretty wide region, prickly. And then we have the basal, which, as the name suggests, is the bottom. So be able to identify these regions from superficial to deep, horny, granular, prickly, basal. If needed, there's an extra clear layer between the horny and the granular. I think it'll make more sense as we talk about the functions. So let's do that. And I've tried my best here to make it as easy as I can. So what happens is, and you can see here on the right, journey of a keratinocyte. I'm trying to make it as fun as I can. So let's first define keratinocyte. A keratinocyte is the main cell type of the skin. It's called a keratinocyte because it's full of the protein keratin. And that is exactly what gives our skin its structure and ability to protect us. So the primary cell of the epidermis is the keratinocyte. All these cells, pancaked at the top, a little bit more circular further down, these are all keratinocytes. Main cell of the epidermis, full of the protein keratin. When we talk about these cells, they are produced in the basal layer, and then they work their way towards the surface of the skin. So when we talk about a journey, this is the journey we're talking about. We build new keratinocytes in the basal layer. They mature, they die, and then they end up falling off. So however many dead keratinocytes fall off, we've got to replenish with new from deeper. I'm sure some of you probably knew this. I mean, even though you can't see it, if you rub your fingers across your skin, there are some tiny, tiny little cells sloughing off. So here's how it works. We're starting in the basal region. In the basal region, number one, we have stem cells. Stem cells are cells that have not yet differentiated. So let's say that down here we have some stem cells. Stem cells have not yet differentiated. That means they have not yet become a specific cell. In this case, of course, these stem cells are going to go on to become keratinocytes or skin cells. But we have these other places in our body. Maybe a stem cell goes on to become a liver cell. Maybe a stem cell goes on to become a kidney cell, but they're not yet differentiated. And you've heard of stem cells. One place to harvest them is from the placenta, right? From a pregnant woman. And the reason that stem cells are so beneficial to us is because they're not yet differentiated. So we think about brain and spinal cord injury. That central nervous tissue cannot regenerate. So once it's gone, it's gone. If we can take these stem cells that have not yet become a specific cell, if we can take these stem cells and put them in the brain or spinal cord, surround them with support, maybe they can go on to become new nerve cells for us. That's the thinking. Well, we also have some of these stem cells at the base of our epidermis. Okay, so in the basal region, we have some stem cells. I know it might be hard to read. This says begin dividing. Okay, great. We also have some other types of cells in the basal region of the epidermis. So remember, we're still only in the epidermis. And I'd like you to know these types of cells. Obviously, the keratinocyte is the main skin cell for structure. But check it out. In the basal region, the lowest, deepest region of the epidermis, we have melanocytes. Melanocytes are what produce pigment or melanin. So we have some melanocytes. We also have some Merkel cells. Merkel cells are an example. This purple thing is a Merkel cell. A Merkel cell is an example of a specialized sensory nerve ending. I think I have a slide later that also reviews these. But for now, the basal region, deepest region of the epidermis, has the stem cells that are not yet differentiated. And we also, this is where we house melanocytes that produce pigment for the skin, and Merkel cells, which are an example of a specific type of nerve ending, touch receptor. But we're going to focus on these stem cells. So as the stem cells progress from the basal layer into the prickly layer, this is the prickly layer. As you can read over there, the keratinocytes form layers. And as you can see, now the stem cells have become keratinocytes. So in the basal region, they're not yet differentiated, but as they journey superficially to the prickly region, they become keratinocytes. I'm also going to introduce one last, I guess I'll do blue. Well, it's blue, so let's do so many color choices, purple. We also have another type of cell. This is the last type of cell you're going to have to know, which is a Langerhans cell. These are found in the prickly region, the blue thing. These are examples of immune cells. I mean, the epidermis is open to the exterior of the body. So it's open to all sorts of bacteria, viruses, etc. So it makes sense that we have some specialized white blood cells right here in the epidermis. In this case, in the prickly region, they're called Langerhans cells. Let's continue our journey of the keratinocyte. In the prickly region, it became a keratinocyte. It's going to continue into the granular layer, or region, This is where the keratinocytes are fully mature. This is where they produce keratin. What were those little dots? Keratin gives the epidermis structure. So in the granular region, these keratinocytes are now fully mature, and they can produce and lay down keratin, the proteins that give our epidermis structure. However, very quickly, after it lays down some keratin, these keratinocytes begin to die. And once we get to the horny layer, the stratified squamous that you're probably familiar with from before, those many, many layers of flat-shaped cells, the keratinocytes are more or less dead. All that's left is the cytoskeleton, the proteins that kept and gave the cell its structure. But you know what? It's okay. Because at this very outermost region, all we care about is protection. So the fact that they're dead, still remaining is the proteins that gave it structure. So it still can give us structure. And then it'll move its way up, and then slough off. And this is happening over and over and over again. You don't need to know how many layers. Okay. This can take, a month or a little more. You don't need to know this, but people ask me, so sometimes if I get a lot of questions, I add it in here just to satisfy your curiosity. But if you're thinking about the journey of a keratinocyte from here, up, and then off, maybe 30, 40 days, but you don't need to know that. This is also extra. Again, this is kind of a fun chapter for a lot of people. We all can easily see our skin, or parts of it. So I think it's pretty natural to have questions about it. Once we get to our other organs, we can't see with our naked eye inside of our heart. So we may not have as many questions in the same way. This is all extra, but if you're wondering, what is a scab? It is hardened material that forms on the surface of a wound. The pus that may come out of it or may show before it hardens are dead white blood cells. I will share with you, this is again all extra, but I will share with you a tip that I got from one of my clinician friends. If you ever wanted to identify in notes, you know, if you're following up on wound care or whatever, and you want to put in a patient's notes that it was still pussy, you probably don't want to write pussy because that looks like something else, doesn't it? So if you wanted to know, the more scientific term is purulent, appearance of pus. Ha ha ha. And then you can read about the scar tissue, thickened tissue over time, that is collagen. But that's all extra. Okay, I gave you some pictures here to follow along with these, like the scar, you know, the dead white blood cells that form the clot, but this is all extra. All right, here's the slide I was talking about, and I did want you to know the Merkel cell. So I'd like you to know all of these. The keratinocytes are the primary skin cell of the epidermis, produce keratin, give structure. Melanocytes reside in the basal layer of the epidermis, produce melanin. By the way, what is the purpose of that melanin? Protection from UV rays. Langerhans cells are the immune cells in the spiny layer. The Merkel cells are an example of a specialized touch receptor in the basal layer. I've given you another example of Meissner's corpuscles, which have a different specialty in their touch senses, but you only need to know Merkel as touch receptors. All right, here's some great pictures, right? Let me just go back for 1 second, make sure I'm using the right terms. Prickly, I think I said spiny, I meant prickly. So basal, prickly, granular, horny. What does it look like on the histology slides that you may remember? I'm not going to ask you to do this on an exam or anything, but I think it's super interesting. This is the basal layer down here. It does kind of get windy, right? This is the basal layer. The basal layer has those melanocytes. And sure enough, don't they show up as darker when they're stained because they produce that pigment? Then we have the prickly layer. Then we have the granular layer where those keratin fibers are laid down. And then we have the horny layer, which is the many, many, many layers of flat cells that we think of, the stratified squamous. Cool. Okay. So that was the epidermis. Now let's move on to the much larger region of the dermis. The epidermis was made up of epithelial tissue. Now we're in the dermis. It is, of course, made up of connective tissue. The dermis has two regions. Again, it says layers. I like to say regions. We have a papillary and a reticular. The papillary layer is only the very top. So maybe where I have this green here, the very superficial part of the dermis is called the papillary layer. And then the reticular layer is everything else. So the reticular layer is much thicker. What is the function overall of the dermis? It connects the epidermis to the body. And this is where we house the accessory organs, or accessory structures, I should say. This is where we house the accessory structures. I mean, this is where the party's at in the little patch of skin. I mean, look at it. This is where we have the hair follicles. This is where we have the oil glands, the sweat glands, the blood vessels. This is where everything's at. All right, so I've already told you the papillary region. It's not really just one layer, so maybe region is a better word. The papillary region is the superficial one. It is made up of areolar connective tissue. All the rest is extra here, but know that the papillary region is the uppermost or most superficial region of the dermis, and it is made up of areolar connective tissue, whereas the much larger region of the dermis is called the reticular region, and it is made up of dense irregular connective tissue, which is the example. When we talked about dense irregular connective tissue, the example that we gave was the dermis, because it is indeed the primary tissue of the dermis. Here's a better picture that's showing you just the very top region is the papillary region, basically where the epidermis meets the dermis, and it is made up of areolar connective tissue, versus everything else is considered the reticular region, and it is made up of dense irregular connective tissue. This is also extra. People have asked me over the years many questions, how do I get wrinkles? Well, the elastic fibers in the dense irregular and the areolar connective tissue, they just lose their elasticity over time. Stretch marks, if we gain weight, have a change in weight like that, the cells get bigger, and even though they may recoil and lose some of the fat within them, we can still have lines of where they were, all extra. I'm not really talking as much about any other specific structure in the dermis right now, because we're going to talk about all these structures when we talk about the accessory structures. So right now, it's enough to know these two regions of the dermis, what type of tissue makes them up. There is, very deeply, the hypodermis, probably from like here to here. Technically, the hypodermis contains these big blood vessels, and then underneath that is some adipose. So the hypodermis is the deepest layer of the skin. What I pointed out to you is large blood vessels. Contains large blood vessels and fat. We know that fat can store energy. The fat helps to insulate us. If you've ever heard of a hypodermic injection, I don't think it's very common, but a hypodermic injection, you're aiming for underneath these blood vessels into the fat. But that's extra. Okay, couple words before we move on to the accessory structures, and then the end of this chapter, we're going to pretty much fly through. I wanted to make a note of skin color. Someone's skin color can be affected by many different things. But of course, the primary thing that contributes to the skin color of a person is how much melanin is present. That is the pigment released from the melanocytes in the basal region of the epidermis. So genetically, some people produce much more melanin and have darker skin. Some people produce much less melanin and have lighter skin. We can have little collections of melanin, like a freckle or a mole, fine. Other things can contribute to skin color. There can be an orange type pigment, especially when the skin is thicker from keratin. And depending on blood flow, if blood moves to an area, that skin tends to look a little bit more red or flush. If blood drains away from an area, it tends to look more pale or blue. So they all contribute, but the largest contributor by far is melanin. Okay, I just wanted to mention briefly skin cancer, only because, as this class is anatomy and physiology, I just wanted to mention the three types. You don't need to know all three types, but I'm mentioning them because they include the type of cell. So here's a great example of how knowing your anatomy can give you a lot of information about a condition or disease or illness or something within the body, right? If we look at basal cell carcinoma, this is going to affect the basal cells of the epidermis. You don't need to know this, just pointing it out. If we're talking about squamous cell, we're talking about the stratified squamous, the keratinocytes that make up the outermost regions of the epidermis. If we see melanoma, because we know the prefix melano and melanin and melanocytes, we know this is affecting the cells that produce the pigment melanin, the melanocytes. I do want to point out one thing that I'd like you to know. This is the skin cancer type that is most dangerous. These melanocytes tend to be quickly spreadable when they're taken over by cancer, so highly metastatic, and they tend to be often resistant to our chemotherapy efforts. If you look at this skin lesion, I mean, obviously it looks much different than the other skin lesions, and the melanoma is darker because it's affecting the cells that produce the melanin. This is extra. I only put it on here for extra information. Perhaps this has happened to you already, or it probably most certainly will. Someone knows that you're taking A&P or going to nursing school or whatever, or work at a hospital, or, oh, Uncle Jimmy at the summer picnic comes over and shows you this disgusting thing on his arm. You know about the body. What is the skin thing? I don't know. Maybe it's just me that happens too. So if you were ever looking to determine whether something on your skin is something to worry about or not, these are some things that you could look for. You don't need to know this for a test, but I'm just telling you. If that skin marking is asymmetrical, that's usually a worse sign. If the border of that skin lesion is irregular, that usually means bad things. The darker it is, the more indicative it is of melanoma. So that's more dangerous usually. And technically, the diameter does matter in that if it's larger, usually there's a higher chance that it's not a good thing. So you don't need to know these, but it's just something to look for. All right, let's get to the last part of this chapter, which are the accessory structures. I'm going to move pretty quickly, folks, because you're just going to need to know the basics. Hair. We know the hair follicles are housed in the dermis. This is a cool look at what the hair follicles look like. If you're wondering, hair is just dead keratinized cells compressed together. Much harder keratin than the skin. Each hair itself has 3 layers, but you don't need to know. We get the pigment from the very follicle base of what color that hair is going to be outside the body. All I want you to know that it's thick keratinized cells and that the hair follicle is housed in the dermis. This is an interesting point, but you don't need to know it. 75% of the hair on most people is not on their head. We forget sometimes the accumulation of the hair on all of our body surfaces. What is really the function? There's Don King, ha ha ha. I mean, you know, not so much anymore because we're living in houses and apartments that have heat and whatever, but a lot of times hair was for warmth. But I'm going to give you another function. It can alert us to the presence of something. So the fact that we have these hairs, if a mosquito, and I cannot for the life of me draw, that's my mosquito. I guess he has a little whoop, 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 whoop. It's my mosquito. Whatever. If a mosquito lands on a hair, and that hair might bend or shake a little bit, the hair follicle down below will recognize that, and it'll send a nerve impulse to your brain. Your brain will send a nerve impulse back out, and most likely cause your muscles to move. So you move, and this causes the mosquito to no longer be on your arm. So it can be protective in that way, to alert us to the presence of things. You don't need to know the parts of the hair follicle. I believe these are a little bit off kilter. I think it should be a little higher. But you don't need to know these. Briefly, nails, they're very hard for protection, and we take them for granted sometimes, but our fingernails in particular are located in a place where they're going to hit up against a lot of things, a lot of surfaces when we do our everyday tasks. So it's absolutely there for protection. All the rest here is extra protection. I just asked these as an aside. Is there a proper way to cut nails? I'm not sure if it's proper or improper, but from my understanding, you don't really want to cut them in a big oval because you'd be more likely to get the ingrown hairs. It's my understanding. I'm no expert. But it's my understanding it's better to cut it more straight across. Or, if we're going to be realistic, it's just fun to draw here, maybe more like that. Yeah. Let's talk about the sweat glands. In our patch of skin, the sweat glands that we're going to focus on, the eccrine sweat glands, are the purple coils. The purple coils are in the dermis, and there's a tube that extends up from the dermis to the surface of the skin. We do have apocrine sweat glands that we don't know as much about, but we do know a lot about the eccrine sweat glands, these coils in the dermis. The fact that they're coiled is more surface area, they can produce more sweat. We have more eccrine sweat glands in certain areas of our body. They tend to be scattered everywhere, but they're more prevalent in our forehead, axillary region, which is your armpit, places. Think of your forehead. What a great big swath area that we can sweat a lot from, right? So of course, the function is to get rid of heat. When needed, the sweat gland will take water, mostly water, send it to the surface of the skin, and then that water evaporates. And the evaporation has a cooling effect, helping to reduce the core temperature back to normal. There would be some electrolytes, primarily salt, and some of us tend to be saltier sweaters than others. The sebaceous glands are the oil glands, and the sebaceous glands are located right around the hair follicles. They kind of look like puffs of smoke here. The oil or sebaceous glands are located right around the hair follicles. They produce oil. A fancy word for oil is sebum. That oil, of course, lubricates the skin. If your skin were to be really dry, it would become brittle. And knowing that the epidermis, the horny region, the outermost region of the epidermis, knowing that it is dead cells, if we didn't have this oil to moisturize the skin, those dead cells would just become completely brittle and they would all fall off at once, and we don't want that. So it helps to lubricate the skin. As I mentioned at the beginning, the skin offers us a chemical barrier. One example of this is in these secretions of sebaceous glands, the sebum or the oil, there are some bactericidal chemicals. So that if a little booger, a little bug, God, I really can't draw. Boop, boop, boop. There's my bug. If a little bug lands there with bacteria, some of the antibacterial properties of the sebum can kill that bug, the bacteria on the bug. All right. That really finishes everything you need to know for the structure and function of the layers of the skin and the accessory structures. At the end here, I just put together some information about things that can influence or affect the skin. There will be some of these you need to know, but not many at all. Most of it is just as a reference. I would like you to be familiar with burns, and you probably already are. Whether you call it a first degree or superficial burn. This is a burn that affects only the epidermis, only the outermost layer of the skin. A second degree or partial thickness burn affects the epidermis and parts of the dermis. A 3rd degree or full thickness burn is going to affect all the epidermis and all the dermis, and maybe even into the hypodermis. So I just wanted you to pair these with what layers of the skin are affected. Lastly, and you probably already know most of this, a 1st degree burn is going to show like a sunburn, redness. A 2nd degree burn, you're going to start to probably have blistering. And then a 3rd degree burn can look all over the map. Dark cherry red, black and charred, can look all over the map. So here's an example of a 1st degree burn. We see some, this is actually my hand from back when I used to wait tables. We can see the blistering. That's a 2nd degree burn. And here are 2 examples of 3rd degree or full thickness burns. I'm not going to ask you to do this. We're just giving some practical applications. You don't need to know this. Also extra, maybe you've heard of it, the rule of 9s. Think about in an ER type situation, if a clinician needs to quickly estimate what percentage of the total skin is burned, how they're able to do that is each body segment is some derivative of 9. Each arm is 4.5%. Each leg is 9%. So if someone comes up with both legs severely burned, full thickness, you could reasonably estimate that 18% of the body skin has been affected. You don't need to know this, but just there. You don't need to know this either, but if the burns are really bad, there may be a skin graft. We take skin from somewhere else in the body, particularly the thigh or the butt, and then we put that over the burned area. The device that peels off that skin looks like a cheese grater. Not a cheese grater, a cheese cutter, I guess. I don't know. It's kind of cool in a sad way, but when they do that, they usually aerate or put holes in that skin graft. The reason they do that is because we need oxygen to be able to come in for repair. And also, you want whatever new tissue from the bottom can form, you want that to mesh and kind of intermingle with the skin graft. But of course, the fact that it's open like this, the most significant problem that can occur during healing is infection. You don't need to know these. I just wanted to give you a reference. You've probably heard of some of these. Contact dermatitis. Break the word down, folks. Derma is skin. Itis is inflammation. Inflammation of the skin. This is usually from unknown origin. It might be from changing laundry detergent or athletes in preseason wearing shin guards or football pads, just some kind of general irritation. An ulcer is a wearing away of the skin. Many different types of ulcers. A bed sore is otherwise known as a decubitus ulcer. Someone not moving, the pressure points wears away the skin. You don't need to know any of these on the screen, just extra. Again, this is extra. What I do want to point out, in terms of treatment, identification is one thing. We can look in books or we can look at pictures to help us identify what's going on. But wouldn't it be important? It is important. Is it a bacterial cause, a virus, or a fungus? Knowing the cause alerts you to the right treatment. If it's bacterial, maybe an antibiotic would work. If it's viral, an antibiotic is not going to work. So just something to think about. These are all things that are caused by bacteria. Don't need to know them, but MRSA, you've probably heard of. I'm not going to ask you about this either. I think it's well known enough. But some of these bacteria strands have started to adapt in order to be resistant to common antibiotics. And over the since they've been developed, folks, haven't, in many instances, antibiotics been overprescribed? Well, the big downside of that is bacteria learn over time. And MRSA is a big strand of bacteria that is resistant to many common antibiotics. These are examples of viral infections, so an antiviral would be helpful. You can see shingles there. Here are some examples of fungal. Again, I'm not going to ask you this, but I'm just pointing out that identifying what the cause is will clue you in to what kind of treatment is needed. So that's all I want to say. Identifying the cause helps with treatment. Okay. Couple slides to end with. Because we're talking about the skin, what are some things that determine whether or not someone needs stitches? Well, the depth is one thing, but not the only thing. This picture here is a pretty superficial wound, but it's wide. So if a wound is wide, stitches are needed to bring the two edges together. So if you let something like this just stay open, that's how it's going to heal. But the idea of stitches is to just bring the two edges together, to approximate the edges. The stitches don't do anything more than that. They approximate the edges of the wound, which then, therefore, allows the body to do its own thing, and it can heal the edges together. Other things that can determine stitches: location. If it's in a place where it's easily seen, you might be more likely to get stitches. If it's in a place where there's a lot of movement, like think about in and around your knee, if that skin is always moving, you might want stitches to help keep the edges together. And then this is all extra, but the skin can tell us a lot about what's going on. All extra, but as you go through, if you're going to nursing school or whatever, these are things that you're going to become familiar with, right? So I've given you examples of some signs of the skin and then what they mean, what they could mean. So this is all extra, but I'm just showing you. This is what the bronzing would look like. Ecchymosis is just a fancy word for bruising. And then again, other examples here. All right, folks, that is the skin. See you next time.